And now a moment from Your History and Health starts first with Dr. Richard Brown.
Hello, podcast family. Thanks for joining this week's podcast. This is Dr. Richard Brown for Your History and Health Comes First. So I'm going to continue with my series on the social determinants of health. In previous sessions, I've talked about the economic element, the educational element, and the access to health and quality element. And today I'm going to focus on the neighborhood and the built environment element of social determinants of health. And I really think that's one of the most important elements because it's difficult to get out of the neighborhood that you were born in if indeed it's an neighborhood that you do not wish to be in because of circumstances that negatively impact your health. So we're going to talk about that. But first, I want to talk to you about this COVID-19 pandemic that we're in. We just cannot ignore that. So I write a column every 2 weeks for the Omaha Star, which is the oldest Black-owned and only newspaper in Nebraska. And it's been around 83 years. So last year at this time in November, I wrote an article that described the state of the pandemic and the numbers and information relative to the national numbers and the local state numbers, which were pretty alarming at the time. But then here we are 1 year later, and have things gotten better? Absolutely not. They've actually gotten worse. So I wrote this article last year, and it was entitled, "I Told You So a Year Ago, Holiday Deaths Due to COVID-19. So what I'm going to do as the first part of our session tonight is just simply read to you the article that I wrote last week that sheds light on where we were a year ago. So here we go. I told you so a year ago, holiday deaths due to COVID-19. Okay, so last year in November, the warnings from local and national health officials about travel and gathering in large groups during the Thanksgiving holiday for fear of a surge of the coronavirus were ignored by many people. 2 weeks later, on December 9th, 2020, it was reported that the US had experienced its highest single day of COVID-19 deaths. Its highest single day in 1 day. 3,049 people died. And a total of 302,294 Americans had died from COVID-19 since January 2020. So 294 Americans had died in January and in November of last year since they started counting in January of 2020. So this week, 1 year later, November 2021, needless deaths of Americans due to COVID-19 infection has risen to 750,000. That's more than doubled a year before. So Dr. Fauci, the nation's leading vaccine expert, warned at the time last year that the start of the coronavirus vaccine distribution will not stop the surge in deaths as the Christmas season could be worse than ever for the pandemic. Dr. Fauci told CNN that he held the same concerns about Christmas as he did with the Thanksgiving holiday. Only, he said, this may be even more compounding because it's a longer holiday. Christmas starts several days before the actual day and continues until the new year. So here we are again. In November, we face the same scenario in 2021 that we did in 2020. Now, under the topic of vaccine access. So the first batch of the first batch of this long-awaited coronavirus arrived in Nebraska in December 2020. There were 15,000 doses that came to the state. So these doses went to the healthcare professionals first, and then the frontline responders and those that were 65 years and older, and those living in long-term care facilities. So health officials reminded the public at this time that the vast majority of Americans won't have access to a coronavirus vaccine until late spring 2021. That was the earliest. So this meant that public health guidelines like wearing a mask, social distancing, and avoiding large gatherings would still be imperative for the months to come to curb the spread of the coronavirus. So after the vaccine was received, a mask was still recommended because it takes a few weeks for the body immune system to build antibodies to protect against the virus. So here we are, we face the same scenario again this year in 2021. So under the next caption is called Dark Winter. Again, we're in a very critical time in this country and in Nebraska. The current period of time consists of the flu season, the COVID season, the holiday season, and still a very unusual political season. Some newspaper reporters said that we're in for a dark winter. Last year at this time, it was projected that by some Americans may not return to a state of normalcy until the fall of this year. And lots of people were trying to get to a state of normalcy. And but that was only true if the majority of the population cooperate with the standards of pandemic safety that was established by CDC. And then there are still anti-vaccine groups and COVID conspiracy groups that flood the internet that could slow the recovery process. Now, this was last year, this was going on. Well, here we are in the fall of 2021, and normalcy has been slow to return. And this is because what they told us, that not enough people got vaccinated or cooperated with the pandemic safety. One of the slogans that we use at Creighton University, COVID-19 project, and still is used today, it is listen to the scientists and public health reps, be smart and follow all safety steps. Now, if we had adhered to that in this nation and in this state, we would be back to a sense of normalcy. Now, there's some that are reducing their safety habits and thinking that we're out of this pandemic cycle, but we are not. There's several states that are experiencing a surge again, even though we've had at least 2, I think 3 surges already. But because of people relaxing a bit, it is thought that we'll have another surge come Thanksgiving and during the Christmas holidays. So herd immunity. You've heard the term herd immunity. Well, what does that mean? This is when a large number of the population of an area is immune to a specific disease. And this happens if enough people are resistant to the cause of the disease or bacteria. It has nowhere to go. If enough people have been vaccinated and have taken safety precautions, this virus, which we cannot see, it has nowhere to go. But it will find people who have not been vaccinated if they are around and they can't get to other people because they are vaccinated. So in order to achieve what the scientists call herd immunity, 50 to 67% of the population must be resistant to COVID-19 before the infection rate begins to go down. Now, this is scientific research and study, specifically quoted from the WebMD. So according to a survey from the Associated Press Center for Public Affairs Research, which was conducted last fall, only half of Americans had taken the vaccine since becoming available. Now today, a year later, only 58% of Americans are fully vaccinated. They told us so, but we did not comply. So we're all in this together. I think you would agree. We're all here on Earth. We're all here in the state. While they're making trips to Mars and the moon and looking for a second Earth, we are still here right now. So we're all dependent on each other to get through this pandemic. Unless there are medical life-threatening reasons or credible religious beliefs, the Earth's population should take the vaccine, which is certified to be safe, as we know. So considering my professional and experience in public health and in health administration and in my individual research, I took the vaccine right away and will take the booster shot. Actually, I've taken the booster shot, so I'm fully vaccinated, plus I'm boosted up. So I encourage others to do the same. As a civilized nation governed by laws, we do not have the right to falsely yell fire in a crowded theater. This is what I wrote in the newspaper. So we do not have a right to refuse to stop at a red light, at a traffic signal, because of the consequences of injury and unnecessary death. Well, you can run through the red light if you want to, but you might kill yourself, might kill other people. And so there's laws against you doing that, and there's consequences for you doing that as well. So it does not seem logical or moral or ethical for people to have the right to jeopardize their own lives, the lives of others and their relatives and friends and neighbors and the population of cities, states, and the planet by refusing to take a life-saving vaccine. So here's my bottom line on the article that I wrote that should sum it up for everyone who, has a brain and who has logical thinking. Those who have taken the vaccine have exercised their right to live. We talk a lot about rights. This right does not infringe upon those who do not wish to take the vaccine and risk death. However, those who refuse to take the vaccine and risk death are infringing upon the rights of those who have chosen to live. And the only purpose of the virus is to kill. The virus is real. Its only mission is to kill. So that was the newspaper article that I wrote a year ago, and I revised it and put it in past tense and sent it to the Star again. And I've gotten several calls and inquiries about the article, people acknowledging that, well, yeah, you did tell us. Yes, the science is there. It was there. It's still here. But still, we have a problem getting to the herd immunity. And there's issues surrounding people still not wanting to take the vaccine, making all kinds of excuses that they have no idea where the origin is from, but they make the excuses. And I say to you, those, and there's been many people who didn't want to take the vaccine, but then they got sick and had to go to the hospital. And so the hospital did what they could to try and save them by providing some type of treatment. But I don't think they questioned the medicines and the care and the treatment that they got to try and save their lives. They don't know what's in it. They didn't do the research. They didn't have any excuses at that point. They took the medication willingly because now they were at the brink of death. All right. So the next part of today's session is on the social determinants of health. And we've talked about 3 of them already. Today, I want to talk about neighborhood and built environment, okay? So the neighborhoods that people live in have a major impact on their health and well-being. Healthy People 2030, which is a document produced by the CDC, focuses on improving health and safety in the places where people live, work, learn, and play. So many people in the United States live in neighborhoods with high rates of violence, unsafe water, there's low income. There's risk, a lot of risk associated with some neighborhoods. Some people are exposed to things at the workplace that can harm their health, like secondary smoke, and even noise can harm your health. And there's lots of interventions that the federal government, some state governments have tried to introduce to try and reduce the safety risk associated with health, but it is not always adhered to. For example, providing opportunities for people to walk rather than having to be in a vehicle, or to get exercise by walking or riding a bike, is important. So there's been initiatives across the country to introduce bike trails and adding sidewalks in some places where there are no sidewalks. And it's all designed to increase the safety of individuals and to improve their health as well as their quality of life. So I was former director of the REACH program, Racial and Ethnic Approaches to Community Health. This is a grant from the federal government, CDC, that challenged us, encouraged us to create an environment whereby we would promote physical activity as a way to decrease the chronic diseases that we know exist in the minority population. So it was focused on the minority population. There's lots of diabetes and high blood pressure, heart disease, depression. And so for 4.5 years, we developed some innovative initiatives to try and help the population in Omaha to participate in more physical activity. So as a result of us going through that and using innovative techniques and creative ways to get the messaging to the people, we created 33 outdoor walking trails throughout the community. We created 30 indoor walking trails. And this is where you identify a particular area with point A, point B, and maybe C, and signs that say, this is a walking trail here. If you go from point A to point B, that's going to be 1 mile. Or if you go from point B to point C, that'll be 1 mile. And if you go round trip, it would be 2 miles. Well, we created 30 of those outdoor walking trails in the area, again, to try and improve the health of the community. We installed 86 bicycle racks. There was about 81 designated signs that talked about physical activity and the value. And we communicated 3,186 messages that promoted physical health through radio, TV, public appearances, and rhythm and rhyme and music tracks. So we know that adolescents who in our society have a lot of idle time, and depending on the neighborhood they come from, they get themselves into the juvenile justice system, or the juvenile justice system sort of pulls them in and brings them in. And so, but what we know and learn through analysis is that many of these juveniles may have a mental health problem or a substance abuse problem. Most programs that help decrease arrests and violent crimes in this age group focus on prevention and early intervention. There's a nationwide program called the Uniform Crime Report Program, UCR, in the United States. It's a nationwide program, and it gathers statistics from 18,000 law enforcement agencies. And what we've learned from gathering all that data is that we have some real problems with crime, but they can be placed in certain categories. Let's see, we have 8 major classifications of crime known as the crime index. And these are tracked throughout the country and they fluctuate. This includes the violent crimes of murder, non-negligent, manslaughter, rape, robbery, and aggravated assault. And then the property crimes are burglary, larceny, theft, and motor vehicle theft and arson. Almost 20,000 people die from homicide every year in the United States, and many more people are injured by violence. Healthy People 2030 focuses on reducing the different types of violence. Now, I'm talking about this because this is where the neighborhood is, and this is why it's a social determinant of health, because if you're in a neighborhood with these kinds of statistics, it could create a real problem for you. So children who experience violence are at high risk for long-term physical behavior and mental health problems. 4.8% of students in grade 9 through 12 reported that they had carried a gun, exclusively of a gun being used for hunting or for sports. 9 to 12, these kids are carrying guns. Now, I happen to participate in a group that actually gets a report from the various police precincts in Omaha, and I've been amazed at the number of guns that they take out of the hands of teenagers. Here's another statistic that's significant, talking about neighborhoods in this country. Every day in the US, 100 Americans die by gun violence. That's 40,000 people a year. Every day, 64 die by firearm suicide. That's 23,000 people a year. If the gun is there and you have an inkling to commit suicide, it's there to do it. And 23,000 a year die from suicide. Every day, 39 people die from firearm homicide. That's 14,000 a year. And then there's another 3 people a day that die from firearm accidents. So talking about the ER, where people go if they don't have primary care, there's about 200 people a day are treated in the ER for non-fatal gunshot injuries. So gun violence is a problem in this country, has been a problem here, and will continue to be a problem here unless the people who are in power and or maybe the grassroots people come together and they pass some laws to make some changes here. And gun violence is a preventable public health tragedy. Guns don't make you safer, it's been proven. They do increase the risk of dying by suicide, homicide, or unintentional injuries. One more statistic on that is that the firearm homicide rate in the United States is 25 times higher than other high-income countries, and the firearm suicide rate is nearly 10 times that of other high-income countries. So, again, talking about the neighborhoods, adolescents who carry guns are more likely to be involved in a range of high-risk behaviors like physical fighting, substance abuse, crime, gang violence. And so comprehensive violence prevention or strategies, again, that CDC is trying to use, and they're providing money and grants for people who will participate in that. Okay, the other social determinant of health in this category of neighborhoods and environment includes the elements or categories of drinking water, air pollution, and lead in the soil. So let's talk about unsafe drinking water. So some of the more commonly reported problems experienced from drinking impure water includes, but is not limited to, the following waterborne illnesses. One is gastrointestinal problems. If you drink bad water, you're going to have gastrointestinal problems because when you're drinking it and you got impurities in there, bacteria and other things that harm the body, it creates some problems with your intestines, and you may get things like diarrhea, which is a problem. You can get nausea from drinking bad water. There's also intestinal and or stomach cramping that can come from drinking bad water. Dehydration, of course, is a factor when you're drinking bad water, unsafe water. And of course, death. There's some water that you can drink, depending on where it's from, that can poison you and actually cause death. Air pollution. Well, we don't think a lot about air pollution until we're coughing and it gets in our eyes and burns our eyes. But air pollution is a very serious problem as well. I never will forget back in the 70s, I think it was, I actually drove to California, Los Angeles for the first time. My goal was to go to California, LA, and become a star. Well, had my saxophone and a 64 Volkswagen and a duffel bag with some clothes in it. But the thing I noticed when I first hit the freeway, in addition to people driving 150 miles an hour, was the fact that my eyes started burning. The pollution was so bad, I could feel my eyes burning and they watered up. I had to slow way down because I could hardly see. That was my first experience understanding that air pollution is serious and it's a real problem. Air pollution can cause coughing and difficulty breathing. It can cause headache, cause dizziness, can cause fatigue. And so if you're living in a neighborhood where you're bombarded with that constantly, you can see how that can decrease your health status and lead to other problems that cause conditions that help your body to deteriorate and your quality of life to deteriorate. There are long-term exposures to pollution that causes respiratory disease and cardiovascular damage. Again, living in a neighborhood where you're bombarded with this constantly, you may not think it, you may not feel it in the short term, but long term, it can cause respiratory disease, cardiovascular disease. It can harm the liver, it can harm the spleen, it actually can cause some cancers, and of course, birth defects. there's been stories and studies where people that um, lived in areas where there were contaminants in the area and pollution of the air and all, it has caused some birth defects among some people. And actually, again, it can cause death as well. So air pollution as a neighborhood condition can certainly create some serious problems for you. And so the last one I'll speak of is lead in the soil. So living in Omaha, I learned that there was a large number of people that had been exposed to lead poisoning, and it came from the soil. So thousands of Omaha kids were tested and found that there were high lead levels in their blood. This was in the year 2000. And according to statistics from the Douglas County Health Department, it's a result of the refinery that was here that was polluting not only the river, but polluting the air and actually spewing large amounts of lead in the air, which got reduced to the soil. And so once it got into the soil, it was dangerous to children because children play outside and they get dirt, on their hands and in their mouth, and they become contaminated that way. There's also lead levels in the paint. It's been outlawed now to create paint with lead in it, but for a while there was not that safety rule, and so a lot of kids got exposed to lead levels in the paint. So what is the problem with lead levels in the soil, in the paint, where children are concerned? Well, children can be exposed to lead by breathing or swallowing the lead, and it causes some serious problems with children. It can cause brain and nervous system damage, learning and behavioral problems, slow growth and development, hearing and speech issues. Now, I believe I have seen some people who have been exposed to the lead levels in the soil in this community, and it has impacted them as adults. The testing that went on back in 2000 stimulated a large amount of money being funded to this area to get rid of the lead in the soil. And so many neighborhoods that were affected had their soil removed and replaced with healthy soil. But the damage had been done. I mean, it exposes you to serious conditions of behavioral learning, so that you don't do well in school. You can't you can't process information properly because the damage that is done to the brain at that early age cannot be reduced. So when we talk about the determinants of health, the social determinants of health, it is a very special and serious phenomenon that exists. And when you're exposed to all of these areas and they're all together and come together in your neighborhood, then it creates a very serious problem for chronic disease. It can contribute to the obesity, the heart disease, the respiratory disease. It contributes to the learning disabilities. So make no mistake, and believe me when I say that the social determinants of health are very, very important and serious. And wherever we can change those determinants and change those conditions in the neighborhoods, we should do that. And there are those that say, well, yeah, there's the social determinants of health, but in reality, it's a political determinant of health, because it is the politics in some cases that created the environment and that allows these conditions to persist and to go on in some of these neighborhoods. So, well, that's my show for this week. I'm Dr. Richard Brown. Thank you. And remember, your health is your wealth, and your history and health comes first. And for a copy of my book called Mission Unstoppable, Extraordinary Stories of Failure's Blessings, you can go to www.leebrownassociates.com. That's www.leebrownassociates.com. Thank you.
This has been Your History and Health Starts First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.